Good morning, Dr. Jasper. Can you please introduce yourself?
Yeah, my name is Jasper Thoolen. I'm a dentist from the Netherlands. My main focus on restorative dentistry, implantology, orthodontics, but mainly digitally guided dentistry.
Yeah. And what do you think about Rayface and the idea of facial scan?
So facial scanning, we have been testing facial scanning for the last 5 years now, and there have always been a few problems with facial scanning. Like the biggest problem is that if you move around, like, you get distortion. So the face scans were never really accurate at all. So what I do like about the Rayface is that it has all these different kind of cameras, like capturing one moment. And that's only the scanner. So the thing that I love most about Rayface is the software and the whole solution and the way it's working together with the CBCT, intraoral scans, extraoral scans, producing a 3D DSD like within a few minutes. And you can use this in office to print it, to give it with patients, to put it in patients' mouths, to do a try-in. It's been amazing. Right? We have been doing this for 4 months now, and it's really, really amazing.
Yeah, I mean, indeed, like, the future is digital, and it's about like reducing the waste, reducing time and cost and all these expenses. And as you said, like with intraoral, extraoral, and CBCT and facial scan, we can actually put it together, and you can already have your 3D patient, which is like the digital twin of your real patient. So in the future, let's say 5-10 years down the line, do you think the concept of virtual patient and virtual clinic will become a reality, and if it's executable?
Well, it's right here, right now, and it's a shame that not all dentists use these concepts on a daily basis right now, right? Because what we see is like in creating this full digital avatar, right, with your X-ray information, with your intraoral information, so we are also doing this with modular and a 4D mechanics, so we can actually see people moving digitally, right? Your planning, your dentistry becomes so predictable. Like even in the most crazy cases, you can try to simulate all these movements and you know exactly where you are heading. Still, like, we are dealing with patients. The patients are very analog, right? We have to perform analog people. So we need people, and we also need to understand that we need dynamic concepts. So you cannot design one thing at one moment and make sure that it's 100% perfect. But you always need time to evaluate. However, your starting point gets so precise that these evaluations and these adjustments are getting so little and little that it's been a lifesaver for us now. Yeah, it's amazing.
That's great. And one last question. As you mentioned, like, not many dentists are actually, let's say, using it right now, and the patients are not also perceptive of like, oh my God, like how it looks like. So what do you think is the blocking concept in this digital transformation journey, and what would you suggest young dentists and also professionals worldwide to just grasp it and start using it?
It's very easy. It's two things: money and fear. Right? Fear of like a new concept, changing a concept that you are familiar with. And it's sometimes difficult to transfer from these kind of concepts, and it can be pretty scary if not everybody's using it. And the other one is money, because usually this kind of technology would cost you over 200,000 euros, right? Now it's 1/10 of that. It's very accessible, and that means that it can, and we see this happening now. We see this going into daily offices more and more and more and more. And you should see the reactions of patients. Like, we make a facial scanning, put in the models in, 3D DSD rolls out, and a patient is sitting next to me, literally all of them, sitting on, wow, you make a difference doing this as a dentist. Because you have this wow moment with your patient. And they say, I don't care what you guys want to do. The fact that you do this in a diagnostic phase to show me what's possible gives trust. Right? And you need trust as a dentist. So from that point on, your treatments even start getting better and better, because people also start to understand why you need things. Like, for instance, when I make this 3D DSD, it's not only emotional or a selling thing, because when you turn it upside down and you look from an close-up point of view and you see that the teeth position are at a certain point, and you see the 3D DSD, you say, okay, this is where we actually want to go. And they say, yeah, but the teeth are not in the right position. I said, exactly. So what do you think we need to do? I said, we have to move them. Exactly. How do we do this? Do I need braces? Right? Just think about this concept. It's the other way around. Instead of, okay, you need braces. Because when I say to somebody, you need braces, say, it's painful. It costs money. I don't want braces. But now you turn it around.
It's like a flipped classroom model.
Yeah, exactly that. Exactly that. It's way easier to understand people why you want to do this, to make it visually, and this technology helps with it.
Yeah. Thank you very much, Dr. Jasper, and we wish you good luck in your journey. And thanks for making people beautiful and making them smile. And yeah, we're all grateful for that.
Thank you so much.
Thank you.